If your shoulder hurts when you bench, press, or just reach overhead, you don't have a weak shoulder, and it's important to know that pain is a symptom, not a diagnosis. Pain doesn't mean injury, it just means that your body is giving you a check engine light. You have a shoulder system problem, and if you keep guessing, tight lats, impingement, rotator cuff, inflammation, bad posture, all of these things, you're going to keep doing random fixes and your shoulder will keep collecting L's like it's a hobby. In this video, I am holding nothing back and I'm going to walk you through the exact assessment I use with my lifting clients to help find the real root cause of their shoulder pain. That way you can stop guessing, stop chasing symptoms, and finally get back to chasing pain-free PRs. This isn't, my buddy had this, so now this is what I'm going to try. Or, fearing the worst thing possible. Not, I saw this reel and it said to do this. We are going to actually assess what's going on. So today we're going to dive into the first step in pain-free shoulders and figure out what is actually wrong. And if you stick with me to the end, you'll know more about your own shoulder than most PTs do about theirs. So let's be honest for a second. Most PTs and YouTube shoulder fixes, they give you a list of exercises, stretches, some band work, and a pat on the back. Good job, keep trying. You're trying to do the right things, but I see it all the time. You get a diagnosis like shoulder impingement or rotator cuff strain. You get handed a sheet of generic exercises and you do them for a few weeks, maybe feel a little bit better. But it's hard to trust something that just doesn't feel like it's doing anything for you. As soon as you start to train hard again, pain comes back. So if that sounds familiar, this video is going to be absolutely perfect for you. And honestly, this could be your big unlock because chances are, if everything I said before sounds familiar, you've never actually addressed the root of the issue. So a few quick disclaimers before we get going. No single test tells a full story. We always want a systematic assessment. Okay, so we want to do multiple checkpoints that point to a pattern. My team and I, we adjust on the fly when we're doing an assessment based on the person in front of us. So it's important to say like, hey, if your shoulder is really sensitive, probably not the best idea to do all of these tests that I'm going to go through with you. You want to pick and choose. Maybe pick a few here, pick a few there, but you don't want to just do the entire list, okay? That will leave you very cranky, your shoulder giving you the middle finger, and honestly, we just don't want that. Another thing, this is not meant to officially diagnose you. You need to see a healthcare provider if you're having symptoms. If you don't know what to do, if you don't know where to start, reach out to me. My team and I will get you set up with what is best for you. Again, I will reiterate, if your shoulder is very sensitive, do not do all of these tests. Break it down into chunks, okay? So here's how we do things differently inside my programs. As you can see, there's a triangle here. We've gone over this in another video. I'm not going to repeat everything, but for today's video, we are going to be focusing on this piece right here. This is the joint assessment, okay? This is phase one. It's the base of the triangle for a reason, and we want to make sure that this is our solid foundation, and this is where every decision is made from, okay? So this is very, very important. We want to make sure that we are testing, not guessing. We want to make sure that we're looking at the whole system, not just where it hurts, and we want to use movement, not just, does it hurt there? We want to say, hey, like what happens as we're going through this range of motion? Okay, I feel it here. Okay, do you feel it the entire time or is it just at a certain spot? What happens if we pull our shoulder blades back, we raise our arm up overhead? Does that feel better? Yes or no? Okay, so that is what we do inside of our assessments. For this, I'm going to try to go into every single detail that I can. Obviously, it's hard to go into every single scenario, every single nuance in one video. The important thing to note here is that this isn't about finding one magical exercise. It's about finding the pattern that's keeping you stuck. And this is the first step in building a system to help you lift pain-free. I want you to see this as kind of a detective process. Okay, so we're not just looking for pain, we're looking for clues. We're looking for other things that could be going on. So this is a very lifter-friendly root cause assessment. And if you do this right, You're going to stop treating the symptom and start fixing the root cause. When I see someone that has shoulder pain, we like to look at a few different areas: the neck, the shoulder, mid-back, and shoulder blade. All of these areas are very important, okay? But I will say, I've had people with shoulder pain and shoulder issues, and in reality, once we started testing, once we started talking, we realized that the issue was coming from their hip or their ankle or something down the chain. So it is very important, again, to get an actual assessment done by a healthcare provider. If you want more information on that, there will be more information at the end of this video on how you can get my team and I to get you an assessment. Before you start this assessment, it is very important to note that if you're post-surgery, if you have something that would prevent you from being able to do this test, you should not go against your doctor's orders. If you are in a cast or a sling or anything like that, use your best judgment. I shouldn't have to say that, but you know what? Here we are. So use your best judgment. This is here to help you. It is not here to make things worse. And so if you have no idea whether or not you should even do this assessment, let me know. Ask me a question on Instagram at Beyond Recovery PRS. I'm happy to tell you if this is appropriate for you to do or not. But again, just use your best judgment, okay? I'm not going to be responsible for you doing something stupid when you know that you shouldn't be doing it. If you found this video helpful, reach out, let me know. I would love to know if this helps give you more clarity. And honestly, I really hope that it gives you that next piece so that you can figure out exactly what's going on. All right, here's my assessment. Again, for the third time, I do not recommend doing all of these at once. If your shoulder is irritated, it can greatly flare things up, okay? So these tests are called provoking tests, and we do exactly that. We're provoking the shoulder so that we can see where the symptoms are, but that can flare you up. So in order to do this, here's what I recommend. You want to find some space where you can move around. You want your phone to record you. Now, I know you're not going to want to record yourself, but I promise you it is going to be very important because your brain and your shoulder will lie to you. So you need that feedback so that you can see what's going on. Another little tidbit for you, make sure that you are looking at both sides. Sometimes cameras flip, and so if you have a watch or anything on, if you wear a ring, it will be very important and very helpful if you pay attention to that when you're watching the video back. So make sure you have your phone set up so that you can record. Now, I know obviously if you're watching this on your phone, it's going to be hard to record and do the assessment at the same time, but no worries. One, watch this on a desktop. You can record on your phone, vice versa. It doesn't matter. I'm also going to drop this assessment link down below so that you can go through the entire list. Obviously, it's going to be better if you can do it with me, but that's what I got. All right. So here is the assessment sheet. All right. So first things first, we're going to check that neck. All right. So why do we even check the neck in the first place? Neck problems can cause shoulder pain, okay? So we want to rule this out first to make sure that there's nothing that we're missing. I always say I like to turn over every rock to make sure that we're actually getting to the root of the issue. Which brings me to another point, full points, okay? This is something that you don't just do once. What I do for my lifters and for my clients is we often do multiple assessments throughout our time together. That way we can make sure, one, we're making progress, and two, we're actually getting to the root of the issue, because pain and injury are like layers, and it is so freaking annoying sometimes, but that's the reality, and we want to make sure that we are reassessing as needed, okay? So, one of the things that we want to look at too is, are we able to influence the pain and the symptoms by changing the movement slightly? So you'll see a little bit more about what I mean on this when it comes to the shoulder assessment itself. But for now, let's dig into the neck. So we're going to just look down, look up, okay? You can see here, you can read just as well as I can. These are the things that we're looking for. We're really just looking for pain, tightness. Does it recreate your symptoms? Are you able to go all the way down? Honestly, too, if you are someone that looks off to the side like this, that will give you some indication that one side might be tighter than the other. Then we want to go side to side, okay? So tip your ear to your shoulder, both sides. Again, you're looking for that symmetry. How are things moving? Are things the same? Yes or no, all right? Then you want to turn your head, so just like this, okay? Again, looking for those symptoms, looking for tightness. Can you go both ways the same amount, okay? Is there any stiffness, any catching, anything like that? Okay, then you're gonna love this. I love doing this on video. You want to stick your chin out, and then you want to come back and make a double chin, all right? What we're looking for here, again, that tightness. How are things feeling when you do that? Do you get any recreation of the symptoms? Next, we're gonna look at some shoulder shrugs, okay? So we're gonna shrug up, and then down, and then forward, and then back, okay? So on those, sometimes when we go forward, we can get some biceps irritation. Sometimes when we go back, if you have an AC joint, it can make things a little cranky. Same with going up or down. We just want to know, hey, does this recreate your symptoms? If yes, great, mark that down. We have something. If it recreates some symptoms, mark it down. May or may not be related, okay? Special move. I don't see very many people doing this one, but it has saved my butt more times than we can count, so it is always going to be in there. So what we want to do, we did the rotation earlier. We want to go about 80%, okay? And then tip your ear to your chest, okay? Just like this. On this one, we're looking to see if when you drop your ear to your chest, does it recreate the same symptoms? Yes or no? Is it the same on both sides? Now, if you have had any kind of neck injury, any kind of like whiplash, concussions, anything like that, obviously use your best judgment here, okay? It's 2026. I shouldn't have to say this, but here we are. All right, now we are going to go on to shoulder movements, all right? So we can do a couple reps in each position just to see. Most of the time people are like, oh, that feels like crap, and then it gets better, all right? If it starts getting worse with more reps, stop, okay? So we're gonna go thumbs up. We're gonna raise your arm up. Again, make sure you're doing both sides. Thumb is pointed towards the ceiling the entire time. Well, you know, thumb is up the whole time. We'll say it like that. So we can see here, let me zoom in. Okay, if you can't get your arms all the way up, maybe there's some tight lats, tight chest, shoulder capsule stuff, fun stuff, right? If you have pinching in the front of your shoulder, maybe it's an impingement, maybe it's a tendon issue, pain at the top. I'm not going to read all of these. You can go through all of these, but you get the point, okay? There are a lot of things that we can go into. One of the things that not a lot of people understand is just because you have pain here doesn't mean that that's the issue, okay? So it really does come down to getting a thorough assessment, because as you move, as you do all these things, it's going to be very important to put all those pieces together, because that is what's going to give us all the information. It could be literally as simple as, when I go like this, ouch. If I take this and rotate back, no ouch, okay? It's the same movement, but you're doing different things, okay? This is passive, whereas this is active. That tells us there are two completely different issues. So that is very important to get as clear as you can on symptoms. Next one, thumb out, okay? So hand's going to be facing the camera. We're just going to do thumb up the whole time, and we're going to go up overhead. All right, so if you need to see that one more time, here, okay, and we're just going up overhead. You want to make sure that you're doing that on both sides like we have on all the other movements. Shoulder rotations, back and then down, okay, and we're going to do that on the other side. There you go. Now, again, you can read just as well as I can, but it's important to know what you're feeling while you're going through this. Do I have pain here? Do I have pain here? Is there some kind of tightness here? When I do this, where's the symptoms? We want to make sure that we're getting clear on these. I'm going to just keep reiterating that because it's very important. Okay, bear with me. Now, behind the back, really all we're doing, this. Okay, if you can't get that high, it's okay. That's what we're doing this for. All right, but again, where are the symptoms at? What is this telling us? Now, it'll be very important to do this in a tank top, in a sports bra, without a shirt on. You want to see how your shoulder blades are moving. I'm not going to do that for this video. Nobody needs to see that. But what we're going to do, you're going to turn away from the camera so that we can see your shoulder blades. So we're going to do those same movements. All right, so we're going to go thumb up. All right, so that's what we got. Again, you're not going to get anything if you have a hoodie on like I do, but you know, professionalism and all that. So make sure you have a tank top or you're, you know, in a sports bra, no shirt, whatever floats your boat. Okay. So next one. All right. What we're looking for on all of those is, you know, what's the shoulder blade doing? Is one side kicking out more than the other? Okay, we're just looking, do things look symmetrical on either side? What is going on? We're just trying to gather as much data as we can. Okay, next one, 45-degree angle. So we're gonna go out like this, okay? So this is the shoulder's most comfortable position. If things don't feel great here, things are probably pretty irritated. So I don't think I have to tell you that. Okay, so out like this, okay, both sides. Next, what we're going to do is we're going to go thumb down and we're going to raise our arm up. I want you to compare this to thumb up, okay? So again, two different motions, testing two different, well, multiple different things, but we're looking in a couple different areas, all right? So thumb up versus thumb down, how does that feel? What's the comparison there? Again, you can read just as well as I can. Pain, weakness, pinching, what's going on? Describe your symptoms as best you can. That will help you. Next, the rotation test. Now, we already did part of this, okay, when we were out here. But this one, we're going to go here, okay, and we're going to go here, all right? I'm going to be honest. So I have a typo on move 3. Before you download this, it will be fixed. But for the rotation test, we're looking at your shoulder being in a neutral position and then your hand and your elbow here, and then you're rotating out, all right? So that's my bad, but it will be fixed whenever you download it, okay? Now, the back check. I'm not going to do this one either because I'm not going to move my camera and my laptop, but you want to essentially get down on your hands and knees, and then what you're going to do is you're going to arch your back, and then you're going to extend, okay? So just like this, pretend I'm on my hands and my knees. My arms are going to be locked out. Okay, I'm just going here. You can see right there, I'm getting some thoracic flexion. And then we want to try to extend in that same area. Then we're looking for the rotation. We want to stay on hands and knees. Okay, we're going to have one hand down, one hand behind our head. Make sure your hips and your back are locked, and then you're going to rotate, really trying to get through that mid-back, okay, just like that. Now, caveat, if you have pain putting pressure through your shoulder, maybe let's skip this. We can probably assume, even though we don't like to do that, that your mid-back is tight, just because 99.9% of people are. This is something we can test at a later date when the shoulders calm down, all right? Here are some common patterns that we're looking for. Impingement, instability, rotator cuff, thoracic spine, all right? You can read through these. Essentially, again, we're looking for symptoms. Where does the pain come on? How does it feel? We want to get clear on all of those things. All right. This is going to help set us up for what exactly we need to do inside of some kind of rehab program. So this is the first step I walk clients through. Then what we do is we pair that if people have lifting videos or anything like that, we're going to take a look at those and compare it to what we're seeing with this assessment right here. All right. So very important to put multiple pieces together. Some important reminders, okay? This is not meant to officially diagnose you. So, use caution, be smart. I'm not responsible for you being like, my doctor told me not to move my arm, and now I'm moving my arm because this chick said to do this assessment. Use your best judgment, all right? Shouldn't have to say that, but here we are. All right, if your shoulder is very sensitive, do not do all these tests, okay? Break it down into chunks. You can do test, retest, but not in the same day. So if we know, hey, movement A hurts, what happens if we pull our shoulder blades back and we try it again? Does that make a difference? Yes or no? That can help to clue us in as to what is going on, all right? Where it hurts, rarely what's actually wrong, all right? Pain is just an alarm. You want to make sure you're finding the fire. Now again, just because we didn't go too much into it, we want to make sure that we're taking a look at your lifts as well, because we want to see what's going on with your bench, your incline, your overhead press, dips, pull-ups, whatever's going on. All right, whatever you're having symptoms with, we definitely want to take a look at those. But I like to look at other movements as well. So one of the reasons why a lot of lifters stay stuck is because they treat shoulder pain like it's a single muscle problem. So they'll do random stretching that they found online, random band work, random soft tissue work, rest, and then jump straight back into the same bench volume that started it in the first place. But what a real plan does is it interprets the assessment, it calms the symptoms while staying in the gym, helps you build mobility, stability, strength in the right order, progress back to heavy lifting without relapse. And it's looking at everything as a system, not just where the pain is in that moment. Nutrition matters, sleep matters. We're going to be going over this in the recovery assessment video, but it is very important to make sure you're giving your body everything that it needs, okay? Now, say you went through these tests and you're like, hey, cool, Kaytlyn, like, I don't know what is going on. I don't know what my next step is. This is literally what my team and I do inside my program. So we take the exact pattern, we do this assessment, we take a look at what's going on, we ask you questions, we get clear on what exactly is going on, okay? And then we're going to pair that with your lifts. So we want to build out your shoulder warm-ups. I call these rehabby warm-ups, right? So we're going to do a little bit of rehab, a little bit of warm-up, and then you go hit your lift. We want to make sure that we're integrating some stay in the gym modifications so that you don't detrain and get weaker and get small in the process. All right. And then we want your progression plan back to pain-free PRs. It's not uncommon for people to hit PRs when we're working together because we ditch the pain, we build the strength, we're making everything move more efficiently and effectively. And by golly, that means we're hitting some PRs in the process. All right. I like to keep people just a little bit longer than what most people do. And here's the reason, all right? Your job, our job is not to just ditch the pain. The real rehab starts once the pain's gone, because that's when we can rebuild strength, we can help optimize movement patterns, and we don't want to do this tiptoeing dance forever. We want to actually build the capacity that's going to get you back to lifting the way that you want to. So if your goal is to only ditch pain, that's part of the problem. You want to ditch pain while you keep training and get stronger in the process, because that's how you're going to build long-lasting shoulder relief. So if you have no idea what your next step should be, DM me the word fix on Instagram. We're going to help you figure out what your next best step is. And if that's to work with us, amazing. We would love to invite you to a call where we can map out exactly what's going on and see if you're a good fit for the program. Now, obviously, we can't work with everybody, and so we want to make sure that it's a good fit for both of us, all right? This will be the first step in getting your customized plan to get back to pain-free lifting. So make sure you DM me the word fix on Instagram. We're going to chat a little bit, ask you a few questions, see if you're a good fit. If so, we'll invite you to that call so that we can map out your next steps together. And if you're not ready yet, totally fine. There's going to be more videos just like this, so make sure you subscribe, like, do all the things, and watch the next video because we're going to be talking about recovery assessment and why that matters and how it could be keeping you stuck. And one last little piece of advice, pain-free shoulders don't happen by chance. You literally rebuild them, all right? So make sure you take the time, you do all this, you figure out what's going on, get clear, and I'll see you in the next video.